Like everyone else, I think at this point we've all seen the video of the surgeon who decided to live stream, and where do you even start with that live streaming? Well, let's not even start there, but we'll come back to that. Like everyone else, I think at this point we've all seen the video of the surgeon who decided to live stream, and where do you even start with that live streaming? Well, let's not even start there, but we'll come back to that. I'm sorry, berating a nurse in the operating room while live streaming answering questions? That's not, was the patient given informed consent as it pertains to the doctor live streaming a case? Answering questions? Where is the defense attorney for the organization allowing a physician to live stream and answer questions? You can be real sure shit if a doctor had wires, catheters, probes, whatever it is into my body, not a chance they'd be live streaming answering questions while you're performing a surgery. No, what? We haven't even got to the berating the nurse yet. How is this even legal? Again, the reason why their errors happens are distractions. If live streaming, and my God, is this doctor making money while live streaming on a social media platform as well as collecting money from the organization, the patient, and CMS insurance? What? Are we like double dipping? And the patient does have to be given informed consent if there is recording that's happening. And unfortunately, it is the nurse who has to say, was this patient consented for this? Because you cannot live stream the anesthesiologist, the nurse anesthetist. Everyone in the room has the duty, most certainly the nurse, unfortunately, leading the time out. But again, we haven't even got to this poor nurse. But we cannot allow the doctor or anyone to be live streaming unless the patient has been given informed consent and it is on their consent form. I worked in procedural areas. If there's even going to be a rep in the room, that has to be put on the consent form. The patient has to be given informed consent. I just see things differently. I was just baffled by that. Now let's move into him berating the nurse on live stream and then going back to delete that piece of it where he does berate her. This is part of the patient's medical record because it would have to be part of the patient's medical record, right? Because you're not live streaming anything that's not part of the patient's medical record. Is that not alteration or deleting a medical record? Whoa, folks. But goes on to berate the nurse related to the suction. I watched this horrible video. We're not in charge of equipment failures. This physician could have respectfully communicated with the nurse. They kept doubling down, saying egregious things about the nurse. I would be suing this physician for slander, 100%. And he gave me a gift by recording it and live streaming it. Don't be, and I will make sure the jury knows that that is an illegal act. And my attorney that's representing me for where to begin, civil, criminal, most certainly reporting that provider to their board as well. I'm also going to call HHS, DHS, APS. I'm going to call everyone that I know because no doctor is going to slander me while I'm at my job. Not going to harass me, not going to bully me, not going to create an unsafe environment like everyone knows, many other creators already talked about. That's literally why patients die. Communication. It's the number one reason why. It's well researched. When that kind of behavior happens, we don't communicate. Therefore, patients die. Well researched and well talked about. All this physician did was play right into that whole narrative. Please, if that nurse is out there, 100% reach out to me. I will donate my time to you. Find yourself an employment lawyer. Find yourself a civil attorney and a criminal one as well. Make sure that you report this provider to all the boards and any nurse, leader, doctor leader. This is conduct. It is your duty to report this conduct. This provider after this case should have been immediately walked out of the building. If it would have been a nurse, anyone else, they would have never tolerated this. The nurse had a duty to go to the nurse manager. The nurse manager had a duty to go to the director. The director had a duty to go to the CNO. The CNO had a duty to go to the CMO. The CMO had a duty to come on down after that procedure to respectfully walk that doctor out of the building. We don't tolerate that kind of behavior. The physician gets walked out of the building just like the nurse would. The behavior gets investigated. And in my opinion, I was a prior investigator. I've been a legal nurse. I absolutely know what the criteria is for unprofessional conduct as it pertains to our professional license. And this is the epitome of it. Absolutely should be reported to the medical board. The patient gets to know if this was recorded, what was not informed of this, and is allowed to have access to that video. And I'm just going to keep going before I wrap this right up. If that provider did this on their personal phone, holy moly, folks. Not only that, they will be handing over their phone because that's discoverable. Anyone who chooses, and it is a choice, to use their phone to communicate or to do anything in healthcare, which is illegal, it's your organization's duty to provide you with a device if you need to use a device while at your job. It's not your duty to provide your own phone or own equipment outside of a stethoscope. Don't get crazy. When you go to your job, so we don't use our personal phones. Please look at the policy, look at HIPAA. I've done plenty of videos about this. Not going to bore you with this, but no, and I did a LinkedIn post. Get on over there as well, because that's where the C-suiters live, and I address this very thing there for a very reason. So no, like, follow, share. If anyone knows this nurse, please have her reach out to me. Again, we'll donate my time to help this nurse. So like, follow, and share, and stay safe out there, nurses. Don't tolerate this behavior. It is a deviation from the standard of care and is absolutely reportable. I would reach out to an employment lawyer. I'd reach out to a criminal lawyer. I'd reach out to a civil lawyer. Stay safe out there. Protect yourselves.